My name is Alicia Swearingen, and I'm a registered respiratory therapist with an adult critical care specialty, and I've been working at CAMC for almost 5 years now. I actually hold a bachelor's degree in respiratory care. I started off with an associate's degree, which I obtained from Carver Career Center, and then I went on later and did a bridge program through Marshall University. As far as high school and the things that they need to be concentrating on is math, science, anything along those lines, anything healthcare related. Not only that, but start getting involved in clubs that revolve around healthcare. HISTA is a great one that promotes healthcare and science-related fields and also offers scholarships. I love helping people. That is the driving force that keeps me coming back every single day. You know, there's nothing more rewarding than when you find that patient that's incredibly sick, somebody's missed something, and you figure it out. And you have their family come back later and tell you, if it weren't for you, my family member may not have been here. You actually helped save somebody's life. There's nothing more rewarding than that, and that's what keeps me coming back. Typical day starts extremely early in the morning, sometime around 6:30, and we come in and we get report on our patients. And getting report just means I talk to the people that were on night shift, and they tell me what's going on with that patient for the day, what's wrong with them, and what we need to do and what our plan is as far as the day goes on. We go upstairs and we start to give breathing treatments, and we assess patients who are on ventilators and do any kind of respiratory work that needs done. And it's an all-day process. The most challenging thing about this career is truly end-of-life care. Regardless of how much we try and how much we don't try, at the end of the day, we're all going to go. And that is the most challenging thing, going in, dealing with family members, and knowing that I'm the one that has to turn a ventilator off. Those are the most challenging things about this job, and things that you take home. We do see a lot of patients who have been smoking. That's actually the huge chunk of patients that we take care of are smokers or ex-smokers. Part of the process in helping someone quit is assessing their willingness to quit. You have to know where they're at in that process to know what the next step is from there. If they're willing to quit, education is the next step from there. You have to educate, 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 educate. Put them in contact with people and resources to get them things, whether it's patches or medications or even just counseling, to be able to begin the process to quitting and actually have a healthier life. High school students need to know where to look to start a respiratory education. So if they decide that they want to go on and they want to be a respiratory therapist, they need to know schools and things along those lines. Carver Career Center has an absolutely fabulous program. Marshall University has a really good program. I was a Carver graduate. They can start into that right out of high school, and they just need to apply for those programs. There are timelines on all of those programs to get in.